Authorities in Savannakhet and Champassak provinces are setting up more quarantine centers and makeshift hospitals to cope with the influx of Lao nationals returning from Thailand. There are concerns about the increase in the number of new infections, with about 40 cases a day being identified, while the number is expected to rise in the next few days. In Savannakhet, a garment factory in Non Savat village, Kaisompuvihan city, is being turned into a quarantine facility to accommodate more than 10,000 people. According to the provincial deputy governor and member of the province's task force for COVID-19 prevention and control, local officials are cleaning out the factory and preparing it for its new purpose. People entering the province from Thailand will be accommodated in the building for 14 days before being allowed to go home. The province now has 11 quarantine centers, while there are 57 throughout the country in total. A large number of people are returning from Thailand every day. At least 300 people a day are crossing the Lao-Thai Friendship Bridge, which links Savannakhet to Mukdahan province in Thailand. Some 30 to 45% of the returning migrant workers have tested positive for COVID-19, with high infection rates recorded in Savannakhet. Local authorities have also set up a makeshift hospital with 1,000 beds to ensure that everyone carrying the virus has access to health care and anticipate that case numbers will rise daily. In Champassak province, authorities are also setting up new quarantine facilities to accommodate the large number of returnees. As many as 38% of migrant workers returning to the province have tested positive for COVID-19. A temporary hospital with 700 beds have been prepared to accommodate people carrying the virus. There are concerns about the increase in the number of new infections, with about 40 cases a day being identified, while the number is expected to rise in the next few days. Champassak provincial authorities have called for additional quarantine facilities to be set up and asked for more patient beds to be provided at health centers, in addition to those available at hospitals. According to a report by the National Task Force for COVID-19 Prevention and Control, on July 29, a total of 241 new infections were confirmed out of 2,082 people who were tested for the virus. Savannakhet reported 143 new cases and Champassak 48. The new cases raised the total to date to 5,675. 6 people have died and 2,691 people are currently under observation or receiving treatment.